that we've really trained 96 participants, even though what we are using now is the pre and post test. But yesterday, one of our graduates who is seated here, Asma Abdullah, he did a presentation here. She did an oral presentation. So that's, and we are glad that Professor Eche also donated 10 million, that more nurses should come. For those that are here, 2 of them are here. They've never been here before. They've never heard about this. So it's a clarion call to us to go back to our various institutions, facilities, and propagate the gospel of implementation science. Hopefully next year we'll be here with a lot of abstract, evidence-based practices that we've accomplished. So I want to say thank you to the organizers, and we look forward to more of this.
Thank you very much. We have 2 empty chairs, so please come over, and 4 empty chairs. So there's opportunity for everybody to come over. And then, as I said, if people have questions, please put them on your Post-it notes.
Lots of room in the pool. Come on in. So before we shift to our next discussant, maybe I thought the last comment really lends itself nice to shift gears into strategies to overcome a lot of the gaps. We all talk about a lot of the problems. We've all experienced all the challenges in translating research into practice settings. What can we do to overcome those? And just also noting, we have a lot of really great collaboration kind of across countries, across different cultures, even within countries. You know, how do we kind of overcome and work within different contexts and cultures as well?
Great, thank you so much. Good morning, everyone. My name is Oluwafumi Ogwa. I work with Village Reach. Village Reach is an international NGO, and I'm Senior Manager, Research, Evidence, and Learning with them. We build responsive primary healthcare systems and ensure that those health systems get to the people at the last mile. So coming to the question regarding how we can build strategies to address issues that we're identifying. One thing that is very key to implementation science is stakeholder analysis and early engagement of stakeholders. I recall that recently, I was called to a meeting with the Lagos State Commissioner of Health while trying to deliberate on how to implement an executive order to have every citizen of Lagos covered by the social health insurance scheme. And then, because a large portion of Lagos State citizens belong to the informal sector, and then that became an issue on how they were going to be looped into that insurance scheme. But one of the things that struck me during that meeting was, so the Commissioner of Health presented data from a study that was previously conducted. And I could hear stakeholders within the room, like debating the data, saying, where did this come from? This is not our data. This isn't it, and all of that. And after that, I reached out again to the person, who had invited us, which was from the Lagos State Health Management Agency, LASHMA. And I said, so we're currently conducting a study. How are we going to make sure that you don't debate our facts when we're done? And then he said, well, it's obvious. You guys are already in the process. You're already engaging us. So we won't debate it. So what I see a lot of times is that the problems, implementation research, implementation science helps you to not address issues at the surface. It helps you to get to the bottom of it, because if you do a root cause analysis, if you get to the bottom, a problem identified is half solved. So if you get to the bottom of why you're having what you're having, it gives you an opportunity to brainstorm and to develop the right strategies. So I wouldn't say that the strategies would be exactly cross-cutting. They could be contextualized. And one way to identify contextual solutions is to engage the stakeholders early on. A lot of times when we're implementing, we dump the strategies on the people that want to use them. But when we engage them, we brainstorm with them, co-create, co-design, That way, we know how exactly we can adapt the solutions to them. And then, we would meet less stumbling blocks along the way because everybody is doing this together and we're able to eventually co-create solutions. So I would just say that strategies would typically depend on where the problems lie, identifying the real problem, keep asking why do we have this? Why do we have this? Until you get to the bottom of it. When you get to the bottom of it, you can come bottom up with the right approach to addressing those strategies. Thank you.
Good morning, everyone. Chibueze Adiri J, Institute of Human Virology, Nigeria, and the Central and West African Implementation Science Alliance. It's unfortunate that we changed questions because I had something I wanted to say about the last one, and I will, but I also want to piggy on what Fumi has said, because stakeholder analysis is one thing. In fact, she mentioned a keyword I was going to push through with co-design. The key thing about implementation science, we're not wondering whether the science itself is good. We know the intervention works. We want to know how well can it work in our setting. It's a very owned thing. It requires ownership. It's not foist. It shouldn't be foisted upon the recipients. So there is that. I also wanted to make a point about, because we were talking about practice and how we can really get implementation research infused in practice. There's an unnecessary delineation between not just implementation research, but let me stick to that. Implementation research and implementation practice in Nigeria, from what I have seen. Emphasis on unnecessary because they feed each other. One of the things that we have tried to do in Expand Nigeria is we have a short-term, Prof. Nadia explained that yesterday, we have a short-term training program focused on imparting hard, so what we defined as hard skills, but really these are core implementation research skills to practitioners. It's supposed to be brisk, it's about 3 months, but we did it, and then we've had them come up with concept notes. We thought about it, and the plan was, oh, with your concept notes, you are doing the work currently. You have learned these things. Come up with ideas, and people were churning stuff out. So that unnecessary delineation, because when you have that, when you have it, and you notice maybe a trend across 3 or 4 or 5 of those concept notes, that is basis for further research. It's a feedback loop that we have somewhat cut off because we do not want to share power. This is me now piggybacking off Professor Aaron's. We like our power in this country. I'm going to speak about the Nigerian context. We like to be in charge. Unfortunately, good implementation research, good implementation science, which is implementation research and implementation practice in synergy, will not allow you to just have that power domicile in your lap. If you want good results, you have to share. You have to be nice and share. You have to let go. And that's where the co-design comes in, because a step further from just stakeholder analysis or stakeholder mapping is, you know what, like the Lashma example, like the example she used, right? So come in, let's do this together. Not just creating the plan. What can we do to ensure that this is really reflective of your situation, so that it is not like we are sitting in an ivory tower somewhere and just pouring this thing on you? Because you find that once somebody can see their voice in something, they feel like it's theirs, and your work is, you've taken it far. There's a lot of stuff you no longer need to worry about. So the delineation of research and practice should not be, they feed each other. And the more we are able to do that, the better we'll see. I'm going to use this opportunity to give a shout out to Kawisa, because we have actually, what we are doing with Expand, we actually have done that in the Gambia, we've done that in Ghana, We're planning for Cameroon, where we are engaging their policymakers and their program implementers and doing very short courses on implementation research. Because once they understand that, and you're telling somebody, oh, no, I'm not talking about p-values, I'm talking about implementation outcomes. They're like, oh, okay, so which one? Imagine you tell a policymaker, we're talking about implementation outcomes, and it tells you, oh, okay, so we want to look at the feasibility. We want to look at acceptability. The conversation has gone halfway because there's a lot you no longer need to explain. Thank you so much. All right.
Thank you. Good morning, everyone. My name is Babatunde Ladiakinyemi. I'm a private consultant, focused on health system strengthening, evaluation and research. I think there are no really big issues for me with respect with how the questions has flowed. So I would still like to address, both questions together. Yesterday at this meeting, I came up with the issue of the private sector involvement in getting implementation results to practice level. As we speak, there is no argument about the fact that up to 60% of Nigerians get their first consultation for any health issue from the private sector, both the organized and the not so organized private sector. And on a rolling basis, when we look at how this conference is even constituted, how well is the private sector, represented in this kind of meeting, where most of the so-called practices that we think are not happening are actually taking place. Now, with respect to Nigeria, there are several ways we measure the impact of practice. We have the multiple indicator cluster survey, and recently we just had our demographic and health survey results for 2023, 2024 came out. And I personally was so excited to see what has changed. And when I looked at that report, and I looked at the maternal, components of the indicator, my heart was broken. For instance, with all the investments in contraception in Nigeria, our contraceptive prevalent rate has hardly moved beyond, it's not even up to 20%. And the last time we had a DHS done was in 2018. That's almost like 5 years ago. So the question is, are we actually capturing all the data of contraceptive services provided in Nigeria? Or we're just focused on a section that, we think is representative of the data we are looking at? As we speak, millions of Nigerians are accessing their contraceptive need from private healthcare facilities. How much of this data fed into the NDHS that we have just seen? So sometimes we may think practice is not happening at the level that we think it should have happened. But in the real sense of it, have we actually done the due diligence in terms of capturing everywhere where these things are happening? Now, the other part for me, people will argue that money is not the problem, but indeed, it's better to shed your tears in a mansion than in a hot street. You will all realize and agree with me that it appears any program that is donor supported in Nigeria seems to have some level of penetration when it comes to implementation. Okay? Think about it. Gavi is there for immunization. PEPFAR is there for HIV. European Union is heavily funding contraceptive, practices, and so on and so forth. And then we hear so much about those things. But then at the end of the day, the indices hardly change. So That brings me back again. It is not practically feasible that all those fundings has been pushed into the system and the indices are not changing. Where is the data collected from? Where is the private sector contribution to this? So for me, I'm an advocate of a greater involvement of the private sector in my work experience, and I'm going to round up now. To get a private health facility to implement basic PMTC services, one of the immediate challenges we get is, so you are coming with this pile of data collection tools. Who's going to do it? Who is going to pay for the time? And then we put in all sorts of measures. But the only measure we don't put in place is how to address that particular question of collecting service delivery data from the people that contribute the most to it. And then we say practices are not happening. So in conclusion, I think we must deliberately find a way of, getting a bigger representation of the private sector into whatever implementation practice we're doing. And then government should come up with a way. So to my dear sister from Lagos State, when the executive order is being written, please tell Lagos State government that they should include in that order how the private sector will be funded. Even though they are for profit, but for as long as government ignores them, you're not going to get their contribution into the whole business. Thank you very much.
Right. Good morning, all. Kenneth Ode. I work with AQ's ACE5 projects in Cross River State. Just to add my opinions to what has been said already, I think we can start with organizers of conferences such as this. This happens to be my first, and the few I've also listened and watched online speaks to a particular theme that has bothered me as it has to do with implementation science. Thomas Edison, I want to believe, is the one. He said when he was told he was a failure, that he had only learned 10,000 ways how not to do a particular thing. And I think that is science. What have we done that has not worked that someone can put up here and one of us learns from it, so that when you go back, you can start to build on that? Because I believe science is not static. What works in one location for one community may not necessarily, if I replicate it the exact same way it was done, it may not necessarily work in my community, in my location. So I will need to tweak something. If I do tweak something and it works, what exactly did I tweak that make it work for me? So that when I'm putting it out there, someone can look at both approaches and say, oh, this way worked here, this way worked in this other location, what way would work for me? Thank you.
Thank you. And we will wrap up today with the last speaker. Thank you very much.
Good morning, everyone. My name is Evans Ejim Karonya. I work for APIN Public Health Initiatives. I'm a monitoring and evaluation expert and an aspiring implementation science researcher. So I would like to look at it from the aspect of the work I do. And I think in the last 1 year or 2 years that the concept of implementation research have really kind of opened my eyes, because when we look at what we do as M&E, traditionally, we tend to focus a lot on collecting data, reporting data, meeting donor requirements. But over the past year, we've been able to look beyond that, because we collect a lot of data, but we don't generate a lot of evidence. And so all this information that we collect all the time, it's nice for us to begin to look beyond just reporting and then begin to look at, are we, achieving what we are supposed to achieve? Are we making any impact out of this. I mean, look beyond just the outcomes, also begin to look at the processes. Are we implementing this program the way we are expected to implement it? So I like to think that it would be nice to incorporate implementation science a lot into M&E, so that M&E is no longer just routine M&E, but M&E is going to focus more on generating evidence that is going to help us bridge this gap in terms of research and implementation. Thank you.
Great. I want to thank all of our speakers today for joining us. Give them a round of applause, please. Hopefully, as you leave here, you'll be able to take this conversation with you. I want to thank you all for your attentive listening and for joining us today. And thank you to my co-facilitator, Rohit.
Okay, so I thought Dr. Akinyemi was here. Okay, so he's not. Thank you, everybody. I think we've had an excellent discussion. Please, let's appreciate our facilitators. All right, so the next sessions will be, so we still have concurrent sessions. So concurrent A will be in this hall and concurrent B in the other hall. So here we'll have reimagining implementation science capacity building, training for impact. So Rohit, you are still on course, right? So
Yeah, thank you, everybody. So you will have those of you who will be here will have the good fortune or the misfortune for having me for another hour. This is going to be a panel discussion on implementation science capacity building. And so if I could welcome our panelists to to take their seat on the podium, we can get started immediately. Do we have all the panelists here? Nadia, Latifat is next door, I think. So, okay, she will come here. Ejamai. So we'll get started in a few minutes. So people, because we have, I think, a couple of our panelists are on the other side of this room. So we'll wait for them to come over. And we look forward to a good discussion. Good morning. Please take your seat at the podium. I might sit right here. So if you want to take one of those other chairs, any of the others.
How many of us there? That many. I guess.
all that.
I'm going to step into the next room and see if I can mobilize the other panelists to come over. I'll be back in just a minute. Ejima, you're required on your, yeah, we're starting.
Okay.
He's the panelist. Well, okay, can I use this one? What should I use? I can use this one. Okay. Good morning, everybody. I think the last panelist is finishing up in the other room. So while we are waiting for her, welcome. Let me introduce myself and let me introduce what the goal of this panel discussion is. I'll ask our other panelists to begin to introduce themselves, and then we can get started. So for those of you who are not here at 9 o'clock, I am Rohit Ramaswamy, and I am a professor of implementation science in the United States. And I am very happy to be facilitating this session today. The goal of this session, this panel discussion, is to facilitate an open, honest discussion about implementation science training for researchers, policymakers, and practitioners in low and middle income countries. Our panelists today, we will explore what training is typically provided, what unique skills are built, how these skills have been applied, what the results have been, and what the future direction of implementation science training in low and middle income countries should be to maximize capacity and impact. So really the discussion is going to be about what have we done with the training so far? We have done a lot of training. What has the training accomplished and what are the gaps? And so without further ado, let me begin to get my panelists introduce themselves, and then we will wait for the fourth panelist before we begin. Ejima, do you want to start? Are all the mics on?
Okay, great. Yeah. Okay. Hi, everyone. My name is Ejimai Eboreme. I will introduce myself first as an assistant professor at Dalhousie University, assistant professor of global mental health and implementation science at Dalhousie University, Canada. But I think more relevant is the fact that my journey did not start in Canada. I have been part of implementation practice for several years here in Nigeria and with experience across several African countries as well. I think that provides better context to this, what we're talking about. So I have at least two hats. One is on the practice side and now on the research side. And so bring a perspective that integrates both hats actually. So that's me in brief. Thank you.
Thank you. Nadia?
Morning, everyone. My name is Nadia Samagudu. I work with the Institute of Human Virology Nigeria here in Nigeria. And I am also a professor of pediatrics at the University of Minnesota in the US. And similar to Ejimai, I do wear several hats. I've been implementing pediatric and adolescent HIV programs in Nigeria for about 14 years and have been conducting implementation research as well. And in between doing capacity building and training implementation science, formally and informally. And I'll discuss that more later. Thank you.
Thank you. Ikapasa.
Good morning, everyone. Shikabasa Halwinji is my name. I come from Zambia, from the University of Zambia. That's where I'm based, School of Public Health. Currently serving as the Dean, School of Public Health, but also serving as a director of our Center for Implementation Research at the University of Zambia. Also, co-director of an implementation hub that we are developing between KwaZulu-Natal, University of Zambia, and Washington University in St. Louis. So that's where I'm based. But I've been working in the space of neglected tropical diseases. Started really on the operations research aspects and then transitioned into implementation research. Thank you.
Thank you. And Dr. Latifat.
Hello, good morning, everyone. My name is Latifa Ibisomi. I'm an associate professor with the University of Witwatersrand School of Public Health. I head the Epidemiology and Biostatistics division of the school. So as part of my unit, we have a field of study that we call implementation science. And we've largely been funded, interacting with the NIH as well as the TDR. I also work a bit with the Nigerian Institute of Medical Research here. So I still do some work in Nigeria. And in relation to my epidemiology, I sit on the accrediting board of Cefinet that accredits with epidemiology worldwide. And I also co-direct health and demographic surveillance system site called BAMISHO. So I think that's it. Yeah.
Great. Thank you. Welcome to everybody else who joined us as our speakers were introducing themselves. I wanted to spend a minute or two talking about the process for today. We have, what I'm going to do is we have a set of questions. The first question I will ask each of the panelists to respond to, just in terms of interest of time, if you could keep your answers to 2 minutes or less, that would be great. And then what we're going to do is we're going to follow up with a set of questions that I will ask each of the panelists one question to start the conversation and ask the other panelists to respond to that. I'm hoping that we will finish the conversation with the panelists in about half an hour so that we will have 10 minutes at the end for questions from the audience. We want this to be an interactive session as well. Okay, so what I wanted to do is I wanted to start with the basics. We're talking about implementation science capacity building, but we can't really think about implementation science capacity building without understanding what implementation scientists are. What do we mean by implementation scientists? And so I'm going to ask this question to each of you, and maybe Ejima, you can start and we can work our way this way. So the question I have, or the first question I have, is what are your expectations of who an implementation scientist is or should be? What different or added value do you expect from an implementation scientist as distinct from other disciplines? For example, program management, M&E, health services research, etc. Do you think that the identity of implementation scientists is too ambiguous right now or overlapping with other disciplines? And how should we be defining implementation scientists from the perspective of capacity building?
Yeah, thank you, Rohit. I think my perspective about who an implementation scientist is has been evolving. Considering that I am a PMP, project management professional, in addition, I didn't mention that initially. There's always been that question about how does implementation science differ from fields like project management, M&E, which is common, and all that. And I've had a whole lot of time to reflect, and I think the role of implementation science keeps evolving now. I think if implementation science is to be a science, right? A scientist is one who observed right, empirically, is able to make diagnosis in terms of gaps and defects in implementation processes, have the skills to do that, and be able to prefer solutions to real-world implementation, right, based on evidence. Now, it's evidence of the intervention and evidence of the strategies to cause a change, right? Now, why I say implementation science perspective definition evolves essentially is that speaking with people, there seems to be this idea that an implementation scientist is one who knows REAIM and CIFAR, right? But I think it's a whole lot more than that. It's a whole lot of the ability to have to design an intervention based on evidence, design programs that are contextual fit, identify ways to implement this optimally, and identify the gaps in implementation and improve them through time to make the necessary impact you need in the real world. Thank you.
So from my standpoint, an implementation scientist is someone who is a practical solver of implementation problems. So they are a solutions person, but they are someone who has a requisite knowledge of the tools you need to use to organize the solutions to the implementation problems. And these people are also people who don't only stop at solving implementation problems, but they can actually, as you said, design, but they design and they can do work that measures the success of the implementation problems such that you can attribute what is causing the success. Same way, if you're identifying a problem, you can attribute what is causing the problem. They not only solve the implementation problems, but they give you measures of success that you can attribute where the success is coming from. And overall, this is someone who understands how to define, select, use, and measure success from implementation strategies. So you have to have a knowledge of what implementation strategies are and how to measure the success of the use of these implementation strategies. Thank you.
Yeah, just to add, so from my perspective, an implementation scientist is one who bridges the gap between what we know and what is being done. So between the knowledge and practice. And so he does that by, of course, understanding the science, the jargon aspect of it, but also being able to translate that science into the context in which he's trying to implement an intervention or to solve a problem. And so there's a lot of adaptations in there. There's a lot of tailoring of strategies and mechanisms. At the end of the day, really what you want is something that will work in the context in which you are trying to solve or to intervene.
Thank you. I think mine is easy after my co-panelists have spoken. So I will put it in a language that my grandma will understand. So basically, an implementation scientist is someone that is able to take an idea that works and make it work effectively in his or her own setting. Thank you.
Thank you to the panelists. So that actually leads me directly to my next question. I'm going to address this question to Dr. Nadia, because we have had these definitions of what an implementation scientist is. We've talked to them. People have said they are problem solvers. They're people who are actually being able to take theory and put it into practice. So then the question is, despite the investment in implementation science training, as one of the speakers said in the fishbowl earlier, why do we still see significant gaps in the effective application of implementation science principles real world settings? How can we make the training more aligned with real world needs and the practical demands of program implementation? So how do we, what do we think of in terms of the gaps in the way we are training relative to what we think implementation scientists should be? And if Dr. Nadia could start, then I can ask the others to weigh in. Please remember about 2 minutes would be.
So where I'm seeing these gaps is, first of all, we are training people in implementation science for the purpose of them being researchers. We are not training people in implementation science to actually practically use it to implement. Even though it's a field of implementation, we are training people to be able to be successful at writing implementation research grants and to get funded and to do the research, publish, have papers, and disseminate to people. But we are not training people to be implementers who use implementation science. So, and I started discovering this in my own work in training people in implementation science, that we're not doing enough in the practical solutions aspect, right? I initially said implementation scientists are people who are practical solutions people. And so that's where the gap is happening. So we have this group of people here who we are trying to train to do implementation science for research. And then we have the implementers and the practitioners here who, if they are trained at all, we are training them as researchers. And so we need to train people to directly use implementation science for what is really supposed to be for practical solutions. So I'll stop there.
I'd like to ask any of the other panelists to weigh in, and also to I think a little bit more about to elaborate on what Dr. Nadia said. Do we think that our traditional training formats, such as workshop and online courses that we've been offering, deliver the intended results that Dr. Nadia said? Are we training practitioners in that way? And how do we think that implementation science training could be delivered that would make it more impactful for practitioners?
Yeah, just to weigh in. So the current training that we have, I think, as Nadia said, is more theoretical. So really what we find is that most trainees, after the training, when they get into the real world, they are blank. Because I think the classroom training was really more of the theories, more of the concepts, more of the frameworks, without really narrowing it down to the practicality. I come from the basic sciences. I originally trained as a biologist. And so in biology, what we do, like other basic sciences, is you do the theory and then you do the practice. You do the laboratory training. But in implementation science, looks like we only have the classroom kind of training and we really don't have that practical aspect. So that's one of the key gaps that I see.
Okay, thank you. Just to support I just want to use a theory to support what she said earlier on about the need for us to use the Kotler-Wins theory of change, if you like. So it is important for us to, first of all, unlearn, especially when we say we are going to the field of implementation science. We need to unlearn what we had before, we relearn, and then we freeze, so that whatever we are going to be implementing going forward will be actually what we are supposed to be. So most of us, we have not unlearned what we had in us before, and that is where we have this overlap or this unclear-cut issues. Then it is also very true in terms of most of our trainings are not practical based. I will give you an example of what we do at VITS. We have a health district, if you like, that I can say that we have adopted. And that is where our students actually go for their practicum. And I remember about the first time that we went, we were still co-teaching with UNC then. Rohit used to be with UNC, and we were actually co-teaching these implementation science courses. So at that health district, we actually take our students there after they have done the core implementation science courses, and we actually go to facilities. We distribute according to facilities that come forward that they have issues. And we actually make them to work with the nurses there to improve whatever issues that they say they have. And this is basically to upskill them so that when they get back to their country, we have students across about 15 sub-Saharan African countries, so that when they get there, they've done it before, and they're also able to lean on the community of practice. We have community of practice, which we've established, you know, in most of these countries. It is the one in Ghana that really works well, you know, compared to the others. So these are some of the things we put in place for them to be able to support each other, and also for them to be able to at least have a good practical experience of what they're learning before they go out there to deliver. So I think maybe we just need to do more of this so that they, you know, they are better ambassadors when they're out there.
Can you talk a little bit about what we need to unlearn before we learn how to do?
Okay. What I've seen grantees or funded programs in the region. So we've worked with some D43, you know, grant holders. You know, we provide the capacity building, they do the field research, and you just find that in the course of you trying to refine, you know, whatever they want to do, you know, they are still thinking epidemiologically. The questions they're asking epidemiological questions, they're asking maybe health system question, not implementation science question, which is about reaching those people that we need to reach with the intervention. So, and it's a lot of back and forth before you really get them to settle into it, you know? So I think that is what so it is very important for us to have an understanding of the principles of implementation science, what is this all about, before we even say, now let's equip ourselves with the various methodologies or strategies that we can use. Yeah, I don't know if that serves as a good one. Yeah.
Thank you. Ejimai, did you have anything you wanted to add?
Yes, please. I think I've seen various models of implementation science training across various parts of the world, and I think it has been very, very successful. But it's been successful in one thing, in winning more implementation science grants. But there is a gap, which Abibang described very, very succinctly, where he said, we had done so much work, earned recognition, but solved nobody's problem. So we have been having lots of capacity building in implementation science, getting people to win grants, you know, having to research more on the problems and understanding more theories and building more theories. But look at where we are today, where our maternal and child health indices in Nigeria, for example, how much change has it had in the past years since implementation science began? Look at other sectors, right? So that means that we really are not making impact where it matters. And that is a gap. And I have a big concern that implementation science may actually be, you know, expanding the gap that it was initially intended to solve. And I think we need to think about new ways to address these issues. Implementation science has key around it, the word implementation, right? And so we need to think of a way to move implementation out of academia to the everyday world. And that's where I think if we're going to make impact with implementation science, the field needs to go there in terms of capacity building.
Thank you. That actually leads me to a question for you again. So what competencies and skills do you think, do you expect from an implementation scientist that would facilitate what you're talking about? So that would facilitate real world implementation beyond theoretical knowledge.
Okay, yes. So in my initial opening speech, I did talk about a spectrum. And that spectrum has guided my work in the real world, essentially. There is the need to have understanding of evidence-based design of interventions, right? Because two key areas of failure in any project or an intervention, no matter how evidence-based, is one, design failure, and two, implementation failure. Now, we've been doing a whole lot of talk about implementation fidelity, but we have not talked about design fidelity in the first place, right? So I think there is need for everyday programmers to think about rapid ways to appraise evidence that would inform the appropriate design of interventions. That capacity is needed, right? And then the skills to contextualize and adapt them in that design before we now go into the implementation process itself. And I think I'm trying to be brief because I have a lot of things to say about this, but looking at the current approaches in implementation science, I think lots of work has been done that's been very helpful. And we do, but the emphasis has been on theories that are more like the determinant frameworks, the evaluation frameworks, which don't do anything more than what M&E has been giving us before. But a whole key part of the frameworks that have been neglected is the process frameworks. For example, the quality implementation framework. I found that very impactful in the work I do. But unfortunately, each time I try to apply that, use that for a grant, I fail. But when I say re-aim CIFA, I seem to win grants with that. But I think we need to go beyond seeing far and re-aiming to actually getting the work done. Thank you.
To that. You had said that we need to take implementation science out of academia, right? But some of the issues we are having is that it's academia and the grant funders who are paying for the training to some extent and the grants. What are the everyday programs investing in their practitioners to learn implementation science and use it? So often we have to go to research, get the funding from there, use it for research grants, and then sort of use that to also train, the practitioners a little bit. What are our PEPFAR programs, our HIV programs, our malaria, our global fund, our national and state health programs investing in training people to do everyday implementation with the tools? And I'll just add, in my mind, what an implementation, someone who is implementing, what are some of the things that they should have? This is outside of the academia, right? You should be able to do co-design. You should be able to do stakeholder engagement. You should be able to facilitate. Facilitation is a key word in implementation practice, where you actually help people to understand what they are supposed to do in implementation. And this is what they call the implementation support practitioners. A lot of us here who are program officers in the programs, program managers, senior technical advisors, a lot of our work is actually supposed to be facilitation. But because we have not thought of that work in the frame of implementation practice or implementation science, we are losing that aspect and we have not been formally trained. So those are a few points I want to share.
Thank you, Nadia. And I'd like to invite the others, but maybe contemplate a little bit more on what Nadia said. So she talked about these implementation support practitioners and these people who we need to train so that they can be good facilitators, implementation processes. But we find in Africa, for example, that this idea of implementation support practitioners or implementation professionals doesn't really exist. And therefore, if we trained people in these competencies, where would they go? And how would we kind of make sure that they get embedded into systems where they can actually be effective?
Yeah, I think one of the things that we see with the African context is when you look at an implementation scientist, because of the nature of our health system, the resources that we have, the context in which our implementation interventions happen, is that most of these practitioners, they play several roles. So the same person who is called an implementation scientist is also playing the role of health services researcher. He's also playing program manager. He's also playing. So because of that, you find that it's in the current setting, it's very difficult to identify, to say, in our context, an implementation scientist will sit at this place in our health system. And so maybe what we need to do in terms of the LMICs is, first of all, the environment itself should be able to absorb, to create the need for implementation scientists, implementation practitioners to be able to perform, to practice in the system. Otherwise, if that is not done, when they go there, they will not be welcome. They will be frustrated because the system is not absorbing the skills. The system is not able to utilize them.
Just to say, because of our context also, like he mentioned, it's not as if we have maybe any position that is even called implementation scientist in our scheme of things. And certainly there's no career path for these guys. Then also remember that in our context, most of the time we do what is available, not necessarily what we want to do. So it is what is available to you that you latch on. So you even find some of them going back, and those are the lucky ones, to their previous job. Others will even lose that previous job while they were training. So, but also in this, there are opportunities for people. Implementation science practice is not necessarily, a specific thing. These are principles that you can apply in your everyday work, in your personal life, and wherever you find yourself. So they are still able to actually use the principles wherever they are, because it's about removing barriers. It's about getting interventions to people that really need this. Now, as an implementation scientist or somebody that has been trained, you are now able to do it in a kind of systematic manner. So we are still able to use it wherever we find ourselves, but it is really difficult to say, I want to do only something that is on implementation science in our context.
Yeah, so then let me ask you a follow-up question, Latifat. Given that there is this idea that we don't actually know people get whatever training they can get and do whatever they want to, whatever they need to do with it, because that's kind of the way that you kind of want to progress. Is there a space then for building capacity specifically in implementation science around the kind of the idea that everybody needs to know implementation science? So if that is the idea, who exactly should be receiving this training? And is there a clear, are we training the right people? Is there a disconnect between the training goals, the kinds of training goals that Ejimai mentioned, and the practical needs of different stakeholders? How do we begin to kind of bring the ideas of implementation science forward so that more people recognize what it is and its value?
That's a very big question.
That's why I get to ask the questions. I don't have to answer them.
Yeah, I always say yes, we've been training the right people. And of course, we need to do much more than we are currently doing. And like I mentioned earlier on, we all need to understand the principles of implementation science, right? And we all need to key into this principle. For instance, if somebody has gone to do the training and you get back to your place of work and you need to do something, or you are trying to bring in your, this mentality of implementation science, something, and your boss has no clue about what you are doing, or your coworkers, the person is like almost failing already. And that is why the training has to be cascaded, through the rank and file. Not at the same level. We don't need to, to understand it at the same level. Of course, we have maybe at the PhD level, we are trying to train theory-based, people that will, give us the knowledge, or be the producers of knowledge in that area. You have at the master's level, and hopefully in the future, we will have at, first degree level. Then we also have at the practitioner levels, we have short courses, we have all sorts of things. But we can also train the policymakers, as well as maybe other people, maybe on short courses. 5-day short course, 2.5-day short course. We've done it before in South Africa, where we trained an alliance on adolescent reproductive health, on, HIV for 2.5 days, just for them to have a basic understanding of what is this all about and how can it assist us. Even the cleaners, it's just a matter of telling them, do you know what we are trying to do now? Actually, we are trying to go this way, in the language that my grandma will understand. So we all need to be on board. We all need to understand the basic principle so that we are all, the alignment is there from everybody. So that at least even if they are not going to contribute, there will not be barriers to whatever you are trying to achieve. We just need to do much more for us to get that critical mass of people that understand it. And it is only after this that we can start moving forward, and start seeing the impact of what we are trying to do.
Thank you. Can I ask all of you on the panel have also had experience with all of these different kinds of training. What do you think about where are we with respect to getting the critical mass, and what else do we need to do to achieve that?
Yeah, so I think, in my opinion, implementation science being what it is, we know that it is an interdisciplinary field, which borrows most of the principles, and even in terms of application, we apply the principles in different spheres. If you look at the health system, literally we apply implementation science or practice at all levels. And so it means that even the training needs to target, as he has said, all levels of the system. Because of that, it means that our capacity building should be across all the different levels of our systems. But when we look at where we are now, perhaps we haven't done very well in terms of that. We might find maybe we have more of researchers. We don't have policymakers who are well trained. We don't have community members who are at least have some appreciation of the implementation science. So one of the things that, if I can just add on to what you've asked, one of the things that can help us actually to maybe move faster is to co-train different cadres together. So we don't have to organize trainings for researchers, organize another training for policymakers, organize another training, because these people work together at the end of the day. So it is important to, at some points, have some core training where we are training the different players together for them to have some basic appreciation.
So I agree with Hikabasa's points. I'll also answer the question in a different way, that we need to change our focus of who we think are the critical mass that we are training. We have not gotten anywhere near, countries outside Africa, like, in the UK, US, whatnot, in terms of how many people we have who have been trained in implementation science for research. But our critical mass that we have been focusing on, including myself, has been researchers, getting enough researchers, getting them to get enough skills that they can independently write grants. I have a program going on right now that we are doing that. But the critical mass that we've not been describing or looking at are the critical mass of implementers and the practitioners and the clinicians. And we have not created content for them to the extent that we need to. So that's the critical mass that's lagging behind that we have to build. And truth be told, recently I was having a conversation with someone at University of Washington in Seattle, and they train a lot of people with PhDs in implementation science. And she was telling me that she's not someone who really wants to pursue research or go into academia, but she knows that she can get a job with an organization, a health organization in the US as an implementation scientist, so that she can do implementation support. She can work as an implementation support practitioner, and there are people who hire her. So here, we don't think about it that way. If someone is trained to that level in implementation science, our mind immediately goes to they are going to academia. But there are target places for people in other places to use those skills directly in implementation or in implementation support. So what we should be doing is creating that pipeline. First of all, people who are already implementing, let's infuse implementation training in their work. And then let's also create a cadre of people who have high-level skills in implementation science who can support health organizations to implement programs or to solve implementation problems. Thank you.
So Ejima, you work here in Nigeria with projects that are actually involve community related. Have any ideas how you might want to think about that, beginning to kind of close that, what I think the last mile gap, and begin to start building that begins to build the critical mass on the implementation?
Yeah, I think my thoughts have been going wild, and it's because this is actually a debate session, and I think I have more questions than answers, right? Yeah, but I've had some time to reflect, and that's the advantage of being the last speaker, right? On the conversations going on, and I thinking about my background as a physician, my training as a physician, and I'm also thinking about my training in implementation science, where we talk about core and adaptable elements, right? And I recall each time I introduce myself as a physician anywhere in the world, I'm asked, what type of physician are you, right? So that means that essentially there is a core element of medical training, and then there's a specialist element of medical training that defines your practice, right? How about we think about that same in implementation science? There is a core body of knowledge where everybody should have, that everybody should have. And then we begin to think about specialist knowledge in implementation science that fits your specific area of research or practice. I think that may be a very beautiful model to think about. And like I said, it's a question, not an answer, right? But I think it's a good way to begin to think. Thank you.
Thank you. I'm going to switch to the last question, and I'm going to ask the panelists to try to answer in 1 minute so that we can have enough time for audience questions as well. And so I'm going to switch the question of, therefore, measuring impact, right? With everything else, as we've said, even with implementation science, we want to measure impact. We also want to measure impact of the training of implementation. A lot of the way that we're measuring the impact of training of implementation right now is whether the students are satisfied with the course. So this is a question for Hikabasa. Are we truly measuring, for those of you who are also having academic programs like at UNZE and WITS, are you fully measuring the success of the implementation science training programs? Are the current metrics and indicators sufficient? Or are we simply using convenient measures that don't actually capture the impact of training? What is your thought on where we are right now with measuring impact and where we might need to go?
Yeah, I think, again, the starting point for me is, why are we training? I think if we can answer that question correctly, then even the way we assess the impact will be different. So we are not training so that we know whether the trainees are satisfied with the training. We are not training so that we have 1,000 people trained, but we are training for impact. And so it means that our measurements should also be focusing in that direction. Currently, our measurements, we do before, after training. After 2 hours of a training session, we assess, are they able to answer the 10 questions correctly? And then we are satisfied. Or how many people have we trained based on the checklist, the boxes that we need to tick for our funders. And for academic purposes, at the end of the year, they sit for a 2-hour, 3-hour exam, and then they get A+, B+, or whatever it is. But that's not the essence. So what we should be focusing on is evaluating the impact. Number one, we should find ways of finding whether the trainees are able to apply the concepts in real life settings. Number two, we should be able to assess whether the trainees have actually brought in some change in their organization, the way business is being conducted. In their small corners, it might not be at large scale, but is there any traceable change that has happened because of the training that someone has gotten? Number three, collaboration, engagement is one of the key characteristics of an implementation scientist. And so we should be able to find ways of evaluating, are these trainees engaging with multiple stakeholders? What is the quality of that engagement? We can also go further to actually look at issues of sustainability. The other day we were talking about sustainability. So is the impact that these trainees have brought, has it continued over time? Or is it a one-off kind of impact? are there health outcomes that we can trace to the interventions, to the changes that have come with the training? So I think when we look at that from the perspective of why are we training, so it means that our evaluations as well should be focusing on really trying to measure those instead of the perspective of the trainees, whether they are satisfied or not satisfied.
Latif, at WITS, are you putting in place some of those kinds of evaluation measures that Ikabasa was talking about?
Yeah, I would say most of those things we actually in place for us. First of all, we belong to this collective that is called IR Connect. It's a WHO platform with 10 institutions on implementation research, 5 in sub-Saharan Africa. And when we realized that there was no standard in what we were doing, so we came together and we actually developed a framework whereby we establish core competencies, in low and medium income countries, that if you say you're an implementation scientist or you've gone through the training, these are the competencies that you must have. So there are 11 of them. And what we do is actually there's a checklist, or and at times we go into the qualitative realm, whereby we try to see, going through the curriculums, are you doing all these things? Do you have all these competencies in whichever parts of the training that you are giving to students? So we do that. Secondly, then we also went on to develop actually these courses. We now have online platform. We are done. I think very soon we'll be launching some of these courses that we have developed online. Then regarding the students, we actually had interview with them where they're working after graduation, whether they've been engaging with implementation science, things that they did, and so on and so forth. And we actually, the paper is under review, that we are currently doing. Then we also went into, that's a paper that we are currently working on, whereby we look at all the various projects that these students have done, and not only at WITS, across, I think, 5 of the institutions, and we did digital data mining as well as manual, to even have an idea of the areas where these students, where they're working, and what are the outputs, what are the critical things that they've been doing, just to sort of ultimately measure maybe the impact of these things in those areas, in those contexts where they've been looking at them. So there are lots of issues that we're actually looking into to measure the impact. We know that we cannot actually be talking about impact now, but at least the contribution of what these guys are doing, to whatever is happening out there. So we do keep a tab, and I guess we still need to do more. Yeah, thank you.
Thank you. And Nadia, for those training, like the Kavisa training for researchers and practitioners, what is your thinking about the state of evaluation of impact?
Right. So there's the CAWISA, the Central and West Africa Implementation Science Training, which is usually, 2-3 days. And then the other trainings that I have are like the Expand NIH-funded D43 grant, which is 5 years. So it also depends on the length of the training, right? So, but I, as a rule, even if it's a short training, I've stopped doing pre-post evaluations. I think they are worthless. That's my thing. What's the point in asking someone what they know 3 hours or 1 day after you've trained them? What are you going to do with that? That's very, very short term. That doesn't mean they are going to be able to apply it. And so we ask more, I think, qualitative evaluations, just asking about their understanding rather than regurgitating points. And then for the D43 train, so that's what we're doing in CAWISA now, but for a longer training program, we're looking at trainee level outcomes, project level outcomes of the training program, and then institutional level outcomes. For trainees, for like the longer term trainees, we're looking at things like science communication, but not science communication to scientists, but to policymakers and to communities. Community dissemination. How do you talk to people? And they are required to do that down the line. Project level, to what degree has the project been able to advance the careers of the research training people? But for the people who are doing implementation practice, the practitioners, we are asking to what degree are these trainees using their skills in program implementation. Then at the level of the institution, we are saying on the basis of having a D43 training program that's focused on implementation science, how does having had that program and having run it change whether we are valuing implementation science as something we want to continue teaching and continue using in our grants and so on and so forth. So the evaluation really should be changing to look at skill building, application of the skills, and whether it is changing the fabric of what we are training in and what we are learning. Yeah, thank you.
Thank you. And last but not least, I'd like Ejimai briefly to provide your thoughts, and then we can open it up for questions.
Yeah, what shall we say to these things? Well, everyone has spoken, and yeah, and I don't have much more to add because it's reiterating what they have said. But I would just say that I was excited. I mean, I have been more of the training by doing type, right? I believe that implementation science is practical. So I think about how my trainees can actually put to work what they have learned. And I think the measures are about them having the capacity to appraise and apply and appraise what they have learned, right? I was particularly, I'll just give one particular example of what happened yesterday. Someone walked up to me and said, Ejimai, I wish you can look at the data, the work we're doing in Lagos with the CC3 team, right? They're right here. And I saw a spike in improvement. We're using a quality improvement framework, and she saw this spike. I was able to appraise them, right? And was excited that the work was actually doing something. And then there were parts where she saw some gaps, right? Which she couldn't understand, but began to think about, right? Why those things were that way. And I felt so proud, right? Because it was evident. I mean, surveys cannot tell you that, right? But you see that and you're excited that, yes, people are actually grasping the skills needed for everyday implementation. So that perhaps adds a practical context to what has been said by the other speakers. Thank you.
Thank you. This is the time I'd like to invite. I think we can take 2 or 3 questions before we need to close out. So, okay, let's start with here. 1, 2, 3, 4, 5. I think we'll start with that, and then we'll see where we go. Thank you. Do you want to start, please?
Thank you very much, the panelists.
I've been told we can go a little bit longer, so we have 5 or 7 minutes to go. So,
okay, thank you very much. I've learned a lot. My own question, or rather a comment, as my brother has been saying there, we have more questions than answers. And looking at building capacity for implementation science, I look at how we generate evidence in controlled environment to implementation science in the real world. But in terms of building capacity, I don't know your thoughts about building capacity of implementation science practitioners to be able to simulate scenarios that are out of the real world. In controlled environment where we're generating evidence is in the ideal world. In implementation science, we try to look at things in the real world. But my friends here in Nigeria will know that sometimes when we implement this evidence, we run into scenarios that are outside of this world. Dealing with systems that affect the system within which we implement. You will all agree with me that, or you will be shocked, some of you here that fund our projects would be shocked that in Nigeria, 6 states or more have had to run projects without power supply for over 10 days. Nigerians, am I right? So in implementation science, we have to begin to build a capacity for people to do simulation of what we may expect that is completely outside what we may consider the real world. And when we look at system, I talk about systems that are outside the system that we are operating, the health system, agriculture, power supply, security. You're a physician. Nobody takes care of that. So in implementation science, we may have to build capacity on simulating all those factors and bring them into the implementation science equation and collect data and actually report it the way it is. Because what I see some of my colleagues do is that when they run into real life challenges, instead of reporting it the way they found it and brainstorm solution, we tend to put it under the carpet. And when we come to Abuja here under bright lights, everybody think that light is available everywhere in Nigeria.
Yeah.
So that's my worries and that's my question. Thank you very much.
Thank you. I'm going to take two more questions so that then the panelists can answer together. So 1 and 2 to start with, and we'll come. So that way, if you could keep your questions brief, please, and the panelists, if I can ask the panelists to be brief, and then we'll take a couple more questions before we finish. So 1 here and 2 there.
All right, thank you very much to the panelists and moderator for the excellent session. I'm Dr. Luakpelumi Aliu, and I work with ECUS. One key takeaway for me from this session is being an implementer with the mindset and skill of an implementation scientist. So following this conference, what is like the immediate next step for someone like that to take towards achieving that objective?
Thank you. And the third one question there. Okay, we'll take 2 more and then we'll have the panelists answer.
All right. Thank you so much. So my question is in the aspect of sustainability. So based on your experience, what strategies have you found most effective in ensuring that capacity building efforts in implementation science is sustainable over a long period of time? Now, this is beyond initial funding or training programs. Thank you.
Thank you. And 1 more.
Okay, thank you, panelists. This session was very important for me because that was the question I had for coming for this conference, which is I've been attending trainings, but it felt like I've not done anything with those trainings that I could say, basically, that I got based on the trainings I've had. So first, my question is, what's the difference between implementation science and clinical audits or audits? Then this is a comment, but I just want to be sure it's correct. It seems that implementation science is a way of thinking that you have, and then this sort of, you come into an environment, you see this is not working, and then you try to use the steps, the systematic and empirical steps in implementation science to understand why it's not working, and then you try to improve on it. It seems that is what it's about. So that means you need research skills, data analysis skills, advocacy skills, and even one of the panelists mentioned stakeholders, engagement skills, and all that. So it seems that is what it entails. So someone coming into implementation science needs to sort of know all this before they'll be successful. I don't know whether that's correct. Thank you.
Thank you. I'm going to ask each of the panelists to answer any of those questions, but 1 minute each, please, starting with Latifat, and we'll go this way.
Thank you. Let me start from the first person, just to say that you cannot possibly imagine all the scenarios that may come up. Okay, so, and that is where the core and adaptable elements of intervention comes in. What are the core that must be achieved? And what are those ones that you're able to adapt, to your context? So I think that would be my brief response to that. On the last one, maybe it's also tied to this. You will have varied results, right? On any proven intervention, because varied people are doing it, varied understanding, varied context, and so on and so forth. But we are trying as much as possible to say we should still be able to achieve a decent outcome wherever we are. And talking about intervention, when something does not work, do we just scrap it, dump it, and look for something else? So we are saying that when there are varied results, it could be an intervention problem. Maybe the intervention is not appropriate, or we did not, look at it very well, interrogate it very well. Or it could be an implementation failure, a good implementation that is incorrectly deployed. And you need the implementation science skills for you to be able to diagnose what the problem is and actually use implementation science tools to get yourself out of it and ensure that this actually becomes something, that is routinely done. And of course, it is about taking it from the lab where we have done our trials and whatever, and actually bring it into the open and make it an everyday issue. Sustainability, people must buy into it. You must engage health stakeholders. You must carry them along. They have to be part of it. And it's a very great tool in sustainability.
Thank you.
I can also answer the two questions. I'll just give an example. So for the first question, implementation science works in the health system, and the health system is very dynamic, extremely dynamic. And implementation science is also a moving target, which is also evolving very fast. So one of the key things for implementation scientists is to be ready to actually change when need arises immediately. I'll just give an example. We are doing a project in Zambia where we're doing HIV costing services, activity-based. And one of the shocking things that we found was that we go into this health facility and the nurse who is alone in the MCH unit has to record information for each patient in 23 registers. Now, this is a nurse who's working alone, and you have a queue outside, and you are an implementation scientist who is looking for fidelity to try and see whether they are following the protocol of what they're supposed to do. So it means that in that situation, you can't do it the way you would normally do it, where you go into a health facility, there are 6 nurses, and they're just recording into 2 registers. So it requires for immediate adaptation to what you are measuring and how you are measuring it. And then the issue of sustainability, one of the things that can be done to sustain the capacity building is what she mentioned earlier on, using mentorship strategies or coaching strategies, which don't just happen at the time you are doing the training, but that extend over time. So you deliberately introduce mentorship and coaching sessions that will continue for an extended period of time beyond the initial training of the mentors. And so you are seeing the development of capacity in the trainees. You are seeing how the challenges that they are meeting, and you are continuing to mentorship. And in that way, you find that it becomes a bit more sustainable in terms of the capacity that has been built.
So I'll address 2 questions, not all of them, but okay, yeah. So for the gentleman from ECUS who said, what are the immediate next steps? I have some letters for you to write down. CTAIR, IVAN. Okay, CTAIR is one of them, CTAIR. The next one is IVAN, IVAN. The next one is NISA, NISA. And the next one is AfriHealth, AFREHEALTH. One or more, all of these, and WHO TDR, the World Health Organization TDR. They have either webinars and they are all free. If you check, they have webinars on implementation science and all of that. There are a few ones that you can pay for. You go to University of Washington, UW, and the UW Hub. The last one is the sustainability really is where we stop doing implementation science training as a side thing and put it in pre-service training, build centers of training and include that in the standing curriculum for all of this. And then making sure that our health programs, like whether it's national or state or PEPFAR, actually have training embedded in the programs that are being implemented. Thank you.
Thank you very much. Yeah, thank you very much. I will just start from the acronyms that Nadia just mentioned. I would say one acronym is GIS, right? Now, following training, you don't just like any other field. You need sustainable training involves passive diffusion of knowledge, right? So you need to network, right? And there are several networking opportunities with GIS, with NISA, and other institutions or organizations where you exchange knowledge, you learn from what other people are doing, right? You understand, and sustain the training and even get more knowledge about new developments in the field of information science. I don't want to belabor I have so many things about systems thinking and system dynamic modeling, which I have incorporated into some of my trainings in information science, and I think it's core because systems are dynamic. But for want of time, I will stop. Thank you.
Thank you, Jimmy. I think they want us to stop. They've cut our mics off. So I wanted to thank all of our panelists for a very, very interesting and engaging discussion. I'd like to ask all of you to give them a round of applause. Thank you. And I know that we didn't answer all the questions, but I'm hoping that you can stay on if there are other people in the room who have questions, so that you can approach the panelists and answer. Thank you very much for attending. And I think this is the last event. So thank you for attending GIS and have a good day.
Thank you. Please, quick announcement. There is a car that is obstructing the movement of several people. It's a Kia, registration number RBC874MJ, black color. Please, if it's your car, kindly come and move it and repark so other people can move freely. A Kia, black, RBC874MJ, obstructing people's movement. Thank you. So this conference is about to, round up. So I think it's a good idea to please just sit behind so we can go into the closing, sessions quickly and have plenty of time to hit the streets of Abuja. And there's still tea break after the closing sessions. So please stay back, relax, and enjoy the rest of the conference. It's not over yet until it is over. Morning, from how you doing? Oh, that's this car thing that's blocking. Hello. I don't know if. Hello. Please, if you are the owner of this car, Kia, black color, RBC874MJ, please kindly come and repark. You are blocking somebody. In fact, not just one person, a lot of people. RBC87MJ, Kia, black color. If it's your car, please, we're about to tow it, since it's blocking other people's access. So don't let us tow your car. Morning. I hope the owner of the car can hear me. We're about to tow the car away. It's registration number RBC874MJ. It's a Kia, black in color. Please come and move it. Thank you. I just stopped the announcement. But nobody's signified, and it may not be in this form. So maybe the other program. Yeah. Because it doesn't look like anybody, shifted attention. If it's your car, you will have seen somebody that will say, "Oh, I'm talking about Hello. Okay, ladies and gentlemen, please can we reconvene briefly to bring this conference session to an end? The photo session out there, by the power conferred on me, that photo session has ended. So please, can we finish up quickly? Say cheese. Okay, now you're done. Please come and sit down. Yes. Thank you, everyone. So I'd like to invite the chairman of the local organizing committee, a very senior, member of NISA and one of the leaders in this sphere of our work in the development world. You met him first day, and now you are going to have the opportunity to hear from him as he closes this conference. He's a very, very unassuming, big man, but you never know, he smiles, he slides through the crowd, but, like somebody, the MC was saying yesterday, when you wear coats, it's different from when you wear suits. From the color, texture of the suit, say suit self get levels. So it's my pleasure to invite Dr. John Oko. He's my friend. I'm a friend to big people.
Good morning, everyone. Can we all settle down quickly so that we can round up? Okay, it's been 3 good days of learning and education, right? And we have come to the end of NISA GIS Global Implementation Conference 2024. Please, can we put our hands together for ourselves? Now, before I go ahead, who are the first-time NISA participants? This is your first time you're attending. Wow, please can we put our hands together for all these people? I'd like to get 1 or 2 feedback from you. What do you think about your attendance in this year's NISA GIS conference? Just 1 minute from 3 persons, please. What do you think? Please, can we, yeah, please.
Good morning, everyone. It's been my privilege to be here and hear. I can summarize it in 1 word, actually. Wow.
Oh, nice. Great, great.
Dedicated, down to earth, yet intellectual conversations. So it's wonderful.
Thank you. Any other person, any of the first time? Yes, please, can you take the mic to her?
Thank you. So I feel bad for the past experiences that I was not able to experience.
Okay.
So I can only imagine all the things I have missed in the past years. So this has been very impactful. It has been very insightful, having to hear new things from different people and then the networking. So it was really a nice moment. Thank you.
Thank you. 1 more person. Anyone out of Nigeria? Anyone? Okay, yeah, let's bring it to Hajia here, please. Thank you.
Thank you so much for giving me the opportunity to speak. I think I'm super happy I feel so privileged to be part of this. This is my first time actually coming here. And then I've seen, I did see loads of lecturers, my colleagues here. So I'm happy that I've been part of this whole thing. I learned a lot about implementation science. And then trust me, I've begin to talking about it in the postgraduate level, because there's a lot of gap around this. Because trust me, some of my colleagues, I was telling them about NISA, they were like, what's that? Even me, when I heard about, got invited, courtesy of PEFA, thank you very much, the NLI program. I'm happy that I begin to talk about this just yesterday about the implementation science. And then we are beginning to think about how when I come back, there's going to be a bit of step down from some of the knowledge I've gathered from here. So kudos to all I want to say thank you very much to all this, to the organizers of this an unbelievable program. Thank you very much for making it so easy, and I'm happy. I'm sure by next year we're going to have loads and loads of nurses that will be participating in the after presentation.
Thank you. So coming together usually is just the beginning, right? We've for first time comers and all the people that have been attending NISA in the past. Now, when you come together, it's the beginning of a new thing. Now, one of the things I would like to ask everyone, can we try and sustain the partnerships, the friendships, and the networks we've built so that we can build better and successful things out of this year's conference? Now, from when it started about 10 years ago, a lot has happened. I remember by the time I was coming, we started NISA as an individual. When I look at my scientific work, it wasn't much. But through the years, my participation and the different things I've had to do in NISA, my scientific work has greatly improved. And I want to encourage everyone, there's a lot that's happened in the past 3 days. Please take advantage of the relationship and the partnerships you build so that you can do something greater. I'd like to just, Carl Jung made a quote I'd like to talk about. He said, the meeting of two personalities is like the contact of two chemicals. If there's any reaction, both are transformational, right? Now, we have all come together. We have all heard a lot of things, shared a lot of things with each other. And I think that from the learnings we have all enjoyed in the course of this conference, you should be able to transform first your individual career, your individual scientific life, and then the work you do as an individual and the work you do in the organizations you serve. Let us take the learnings from here to work with it, do something with it that can change our communities and change our nation and change the countries, all the countries that participated here. So to everyone here, I'd like to say thank you for coming. Thank you for your active participation. I was looking at the reviews yesterday. When we were planning and talking about the gala night, one of the things that occurred to us was how many people are going to come, looking at past experiences. And I was really shocked that at the gala night, the attendance was superb. And when we're thinking about this morning, it's a Saturday morning, most persons would have left. But just look around and see the level of attendance. The participations in this year's NISA is really unusual and much more than I have seen in past NISA. And please, can we put our hands together for ourselves for great participation in this year's NISA? Now, just to sincerely appreciate everyone that's taken out time I just imagine if we had planned a conference and you didn't attend, it would have been a useless conference, right? But everybody took out time to come. I just want to thank all the registered participants that were here. And I also specifically would like to thank all the speakers, all the panelists that made NISA 2025 a success. Please, can we put our hands together for all the panelists and the speakers? Now, to the Global Implementation Society, the partnership for this year was unique, right? And it transformed the outlook of NISA. And I would like to thank all the members of the Global Implementation Science Society, first for agreeing to partner with us as NISA and for coming to Nigeria. You know, when you talk about Nigeria out there, a lot of people are scared of coming to this country, but they agreed and they are here. And we'd like to thank the members of the Global Implementation Society for partnering with us and for being here. Please, let's put our hands together for them. And for the team from China, where are the Chinese guys? Okay, please, can we put our hands together from South Africa? the team from South Africa and from other countries around Africa and the world. Please, can I see your hands up, please? Please, let's put our hands together. Thank you for coming to NISA GIS 2024. And I also like to thank the NIH team. Now, from the inception of NISA, one of the great partnerships that made NISA stand out is the partnership with NIH, right? They are always here in terms of all the workshops that NISA organizes from time to time, and every conference, NIH is always usually represented. Please, can I see the people from NIH here, please? And please, let's put our hands together for them. Thank you for working with us, and thank you for supporting NISA. Now, and to all the sponsors, Caritas Nigeria, CCRN, Delta FI, and all the sponsors. Without the sponsors, this year's conference would not have been possible. I remember Dr. Eche and Olawepo, you know, usually NISA conference, we don't spend more than 40 million naira in the past. And when we put together this year's budget, it was over 100 million. And we're wondering, how can we succeed? But eventually, with the support of all the sponsors, we were able to gather all the resources we needed. And please, can we put our hands together for all the sponsors that supported us this year? Now, as NISA, we like to learn to improve subsequent years. And there was an information that was passed through your table yesterday. If you have not responded to the feedback, please respond to it and let us know, where did we not do very well? Where do you think we can improve, so that we can ensure that by the time you are coming for NISA 2025, it will be a different ballgame entirely. And we will also write to you the emails you used to register for this conference. We are going to get back to you and write to ask for more additional feedback to see how we can improve NISA 2025. So please, when you see our emails, kindly try to respond to it. Now, at the end of this session, tea break will be served outside, and there's also going to be a workshop at the end. Now, if you'd like to attend the workshop, please stay back and attend the workshop. Now, please, can we put our hands together as I welcome the GIS team to the podium, please? Nice. Yeah, where's Peggy and Matt? To be nice to see. Okay, nice. Now, because of this collaboration, right, with GIS, we're talking outside there, right? NISA has become a global implementation conference. And we would like to sincerely and specially appreciate all the persons from GIS to say thank you for making this year's NISA special and unique. Please, can we put our hands together for them? Rachel, you want to come? At the end of the conference, please take our time to go to the booth, take some snapshots. Take snapshots with random people. You might never know, you just meet them again. And I'd like to, Nadia and co, please snap with her. She's a great resource to us in NISA, right? And we want to thank everyone. Sincerely, you have made NISA 2024 unique, and we thank you for coming. And we look forward to seeing you in September 2025 for NISA 2025. Thank you, and God bless you.
Hello. The first day it started, everybody thought I was gonna blow an aneurysm, but I'm still alive and I'm still well, which is a good thing. So I'm thinking that for all of you, the same thing is happening to you. You are also relaxed. So it's much better. So there are two things that you have to remember. So we have organized for those who want to do that, to take you a little bit around Abuja. So if this is your first time in Abuja and you wanted to take a ride across, we provide the bus and the driver. They will take you to 3 main places. We are not going to go out of town. We try to stay 10 miles within the radius of the American Embassy. So that's what we try to use as our landmark. So we don't go far away out of town, but inside town. So if you are interested, please join that. The second thing is that we have a seminar that is coming up after this. which is on grant management. So there are people who are specifically interested in it. I think it's a good thing for both the investigators and a good thing for those who are also supporting those grant management in their office. So if you have a grant and your grant managers are not here, I think you should stay back. You are going to learn a lot, because today we're going to launch a very new collaboration between Nkura and NISA called the Nkura African Initiative. This initiative is Nkura stands for the National Council on University Research Administrators. This unites research administrators of many US institutions, Harvard, Hopkins, Duke, and they're not including the ones you may not even know or remember. But all of them have organized so that they are not alone. If you are at Harvard and you're having trouble with grant management, you can tell somebody else that is at the University of Kentucky, and they can help you if they have those resources. More importantly, you don't have to start from afresh. There are so many forms, financial conflict of interest, all the things you have to learn to manage grant that already they have, that you can actually do that. The other thing is that because you're a member of NISA, you will also be able to know that you can get a reduced membership of Nkura through NISA, this collaboration with NISA. So if you stay back, there are a couple of things you're going to gain. One, if you're a research administrator, you're going to meet other administrators. We already have 10 or 15 of them now that are members of the research administrator. We want that number to grow. If you are not, and you are the PI or the investigator here, and your research administrator is not here, I think you should stay back. We have also, in that seminar, had a session for people who are PIs, people who are eligible to be principal investigators, to say, how do you become prime? This is something that we have done so many times. Many of the Nigerian institutions has been a sub to other institutions, and the maturity demands that after many times of being sub, if you are doing well, that you become the prime. And then that's one thing, you know, when you manage a grant as prime, then you know that you have had all the capacity. It's not as easy as many people think. When you are a sub, somebody else is doing the work. But when you become prime, nobody else is you. So I think one of the things is to be a sub with someone that you know very well. And when you become prime, be with that same person so they can help you and let you know how they did it. And that's when you complete that infrastructure. There is also an online version of a virtual meeting that we have, you know, that is going to happen. If you look at your agenda, you will see that is online. So if you rather go back to your hotel and take that online, that is another program that is going on. So please sign on. If you don't know the link, please ask before. If you catch me or catch Dr. Olawepo, you will get the link. So if you're back in your hotel and you're tired, you can turn it on while you pack your bags before you leave. I know many people are leaving this night. It can be your last thing to listen to. But before we close, finally, I do want to especially thank our host. Every year there is a host organization. So I do want Dr. Oko to come back here, and I do want Dr. Amana to come back here, and I do want all the leads for Caritas committees that put this together. I want you to join us on the stage. I don't think it would be nice for us to close this conference without giving them a really good round of applause. So if you are from Caritas, please come up here. That, you know, part of the leading committee, please. So, you know, there's something that you probably may not understand, that we have to time the airport pickups. We have to time the people that pick you up in the airport, drop you up in the hotel, pick you up in the hotel, drop you up at the conference area, and hopefully we will take you back to the airport as you leave. And all of those is what our host organization help in doing that. Our logistic committee have done very wonderful. I hope that you enjoy the food. So those are the people, but I really want them to come up here. There is something else that they did this year that is usually different. Every year, we have registered everybody that is here as compliment because they have done volunteer for this work. This year, as they told you, our budget went from less than 40 million to more than 100 million. And we insisted that everybody that is a volunteer will be registered for the sake of trying to raise funds. And not only did Caritas do all the things they did here, they gave us 10 million. They hosted this by arranging all of those things, and they registered more than 25 people that are in that place. So please give it up for Caritas, please. And they know that their work has not ended. So that's not how we end in NISA. So what happens is that in each of those 7 committees, we will have one person stay back from Caritas to support the next organization that is going to host. Because you don't want to be the next host and you don't know where it's in. So we want to start from here. So their base will be this 2024. So you can imagine what 2025 will look like if this is their base. So we're going to have someone from Caritas stay in each of those committees to support Solina. Is anyone here from Solina Health? Please come up. So that is our host for next year. So please. So, and I always tell them they're not going to be alone. So they are looking for a team that has done it before. And in each of those standing committee, we also have, last night you saw us when we give an award to Gloria. She has been on the logistic committee since 2015. That's 10 years. And that's what you're going to see as we do. So, Selena Hout, you want to wave your hand so everybody can see you? Okay, that's the man you're going to be looking for in 2025 when you come. Okay, and then just like he's standing there in front, you're still going to have all of those Caritas people standing behind him and making sure that these things go. Please thank all of them for us, please. Thank you. Thank you. Thank you. So stay back for those seminars. Those seminars are optional, but it's a pre-gift to everyone that have attended the conference that want to learn more about grant management for you or for your grant managers if you are the PI. We also have a session for the PIs about the things that are different from being a sub and being a prime. Thank you all for 2024 and see you back in 2025. Thank you.
Hello, everyone. Can you hear me?
Yes, now I can.
Yes, and you can hear me, Vicky. Hi.
Yes.
Mads, are you here?
Yes, I am here. Hi,
Awesome.
Matt. Hello, hello.
Yes, thank you. Excellent. So just to be clear, is this being broadcast in the room there, or is it just us in the on the call here?
It is just us on the call. Registrants have been asked to join from their hotels. And all have been sent the link.
Okay, great. So we'll go ahead and get started, and we will let you as the moderator and host introduce us. So we have this I'll go through the slides for you.
All right, thank you. I was just getting to a quieter spot so I can introduce you all without being too distracted. All right, so our hosts today are Vicky Myers and Janice Pizzuto. Vicky Myers has spent 20 years of her special education teaching career working with struggling readers. She went on to serve as an IDEA compliance supervisor at a State Department of Education, followed by several years providing professional development to support teacher knowledge and skills for improving their students' reading abilities. She had the opportunity to work with colleagues to implement structured literacy, progress monitoring, response to intervention, RTI, multi-tiered systems of support, MTSS, and data-based decision-making in districts and schools in their state. She went on to serve 8 years at the United States Department of Education as a special assistant in the Office of Special Education Programs and the Office of Elementary and Secondary Education, followed by several years as the Senior Legislative and Outreach Liaison for Wilson Language Training. These experiences provided not only an understanding of policy and grant making at the federal level, but also the importance of family, school, and community engagement in moving the needle to improve literacy rates across the country. Vicky's academic accomplishments include BS and MED degrees in special education and a PhD in educational leadership and policy analysis. Her doctoral work centered on the implementation of federal grants and the impact of implementation variance on teachers' feelings of efficacy. Her current consulting work continues to focus on the importance of implementation for supporting teachers' beliefs and attitudes that their efforts can and will result in the valued outcome of ensuring their students learn to read. Janice Pizzuto is the founder of Impact Lead Succeed and has a passion for contributing to the world of implementation through education, the involvement of implementers, and simplifying the science for others. After years of seeing innovation efforts of high-quality evidence-based practices fail, she dedicated herself to impacting the implementation gap by helping build implementation literacy across sectors globally. We can get results that impact humans and societies in positive ways when we apply implementation and improvement science to world problems. It is her mission to demystify the sciences and shine a light on effective implementation to impact lives and improve outcomes. Janice Pizzuto is currently an implementation specialist, consultant and collaborator with her own company, Impact Lead Succeed. Her skills of facilitation, adult learning presentation, data-driven decision-making, and results focus have led her to provide outstanding support to a variety of clients, primarily in the education sector. She is an experienced facilitator and coach, one of the best I've ever had the privilege of learning from, and has served in a variety of leadership positions. Janice has an advanced degree in education and holds licenses for teaching and administration. She is an innovative and creative professional. She is skilled at serving educators and nonprofits with experience in designing, leading, and supporting large and small conferences and learning events. And she is currently serving on the Global Implementation Society Board of Directors. Thank you, Vicki and Janice, for being here today. I pass the mic to you.
Thank you, Mads. That was quite an introduction. Thanks. I think somebody glorified that for me and for us. We want to extend that thank you to the Global Implementation Conference, NISA, and the Global Implementation Society. Over the last few days, it's just been so inspiring to be a part of hearing this innovation and commitment to really bridging the gap of moving some of the conversations that I was able to hear in the wee hours of the morning. My husband's like, what are you crazy getting up at 3 a.m. and tuning in? But it's that important. The work is really important. And the focus that I've heard from the very opening from Roman talking about the backpack, he mentioned that his backpack is small and nimble. And he has the tools that he has in that backpack, but he showed a photo of another person with a backpack who's this giant backpack, and that could be a practitioner, an implementer. Other people have more knowledge and skills or different knowledge and skills and capacities than we have, and that really resonated with me all the way to just now this morning, was morning for us, here in the US, they were in the fishbowl, some of the conversations around learning together and alignment and really looking toward capacity building. So we are grateful to be a part of the conference, and we thank the NISA and GIS teams that brought this conference to life. Did you have anything you wanted to add there, Vicki?
No, it's Oh Dark 100 for me, so I'm just glad to be here.
Right. Okay, so let's move on. We're going to start today with this is a collaborative learning environment, and together we're going to have some discussions with the concept that really being that the learning is more important than being right. And I know that in research and academia, we always want to be right, but what we find in implementation science, in change, in learning theories is that the learning is more important than being right. So our effort this morning and our goal is to learn with and from each other. And this quote, so as I'm reading this quote, if you could put in the text chat, where are you from and what is your organization and your organization role? So Mads, if you can help us with maybe reading those out when I'm done with this. To be successful beyond the very short run, right? We don't want to just be successful in the short run. All organizations, and I love this quote, that in the fact that includes all organizations, must incorporate moral purpose, which is why many of us are in academic and research, and all the wonderful people that we heard from over the last 3 days are really trying to do important work to change the world in really important ways in underserved populations. They need to understand the complexity science and respect, build, and draw on new human relationships with hereto uninvolved constituencies inside and outside the organization. That's kind of a complex statement, but what he's saying is we can't do this work in isolation. We can't have just research and policy saying what the people who are actually involved in the work do the work. So this morning, we are going to be asking the question of how do we include the implementers in the work? We're going to share a couple of stories and some experience from us, but then really this is an interactive session. And so this is going to be something where we're going to have our cameras off and we're going to go into breakout rooms and we're going to discuss together 3 questions. But before we get started, I want to talk about the elephant in the room. Quite often, the elephant in the room, really, this is a parable about six blind men, and many of you may have heard this parable before, and some of you it may be brand new to. But in the parable, six blind men are starting to argue about, well, what does an elephant really look like? So they decide, well, let's go see what this elephant really looks like. And so one of the blind men grabbed the elephant by the trunk and they say, oh, an elephant is very much like a snake. Oh, another blind man touches the side of the elephant and he goes, no, 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 an elephant is very much like a wall. Another blind man touches the elephant's knee and says, oh, no, 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 an elephant is very much like a tree. Another one grabs the tusk. He said, oh, no, no, an elephant is very much like a spear. I mean, and they're all very convicted in their view of what the elephant is like. And the last one grabs a hold of the elephant's tail, says, no, 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 an elephant is very much like a rope. And oh, let's not forget the ear. That's the last blind man, says an elephant is very much like a fan. So we have a lot of conflicting views for the same thing. And in implementation science, and when we get into the field of implementation, we quite often don't see the elephant in the room because we're all coming with our own perspective. We all come with our own previous baggage. And many of us don't come with the knowledge of the local people we're working with and serving. And we don't know the context, the climate, and the culture. I'm going to talk about 3 C's this morning. 2 different ones. One is context, climate, and culture, and context, climate, and culture matter so that we don't all end up thinking, oh, this is the right answer. We have to see things together. Because what we know and have found out through years, Vicki and I will say this, it's been, we're not, yeah, I'm not young. And it has taken a lot of years to find out and really, really just viscerally believe our moral purpose and compass is around everyone matters. And the practitioners involved in the interventions that we deploy matter. And we need to see practitioners' perspectives. So this morning, we're going to share with you a couple of things before we get started on our World Cafe interactive component. This is some data. So we're like, if we're going to talk about implementation science, we do want to have results because results do matter. So this, I'm going to give you some data around an organization that I've been working with they're in year 3, so time and process. And it started out with an audit. So I'm going to share some of their recent audit data and their beginning audit data and talk a little bit about some of the things that happened along the way, which included the implementers in the design to get to these results. The audit included, it was very rigorous, interviews of staff, interviews of leadership, interviews of the community, surveys of staff, leadership, and the community, stakeholders, observations across all sections of the organization that were going to be impacted and involved in this work. Artifact review, because in an observation, a survey, in an interview, you might hear one thing, but then it's like, oh, show me, right? So we dug in and actually audited schedules, whatever was involved in the process. This is looking at an organization that is a school district, and they were doing response to intervention, multi-tiered system of support. And there are a lot of documents that must be in place to actually have it in place. So we did an artifact review of all of those elements and a data review, looking at their data, their outcome data and their formative data. All of those things were part of the audit. I'm showing you some of the recent survey data. So this is from 2021. And what we're looking at here is the perception of the staff thinking that their school district has communicated a long-term vision for response to intervention or multi-tiered systems of support, a very important framework for improving student outcomes, and especially for marginalized students. And what we see, I always like to say, there's a large portion of blue, and some people don't even know that it should involve them. And some of the people that answered this question in blue are actual interventionists. Like, okay, this is a problem. So we see some problems here in this original data. And I always like to say in data, we want to see more green and less of the red, and in this case, blue. So we definitely have some room to grow. This is the same question. Now they understand that RTI is multi-tiered systems of support, so MTSS. And what I just love, I'm so excited. This is hot off the presses. We just did this in October. And what we see is a lot of green and purple and very little blue. I love that because it says the people that don't know that they're actually involved in this work has gone way down. And we see that we have, what is that, almost 84% of staff strongly agree or somewhat agree that they have a long-term vision for this work and that they understand that their leadership, their staff, and their community are all committed to scale this evidence-based practice. So huge success. Can't wait to share it with the school board and the community and the stakeholders. Like I said, it's hot off the presses. You're getting this first. Because results matter. We can't spend 3 years working with an organization and not see that we're measuring the understanding or measuring impact. We're not measuring, did we do it? Checking off the box, were the changes, did we provide training? Did we give resources? That's not enough because that doesn't change the day-to-day practice of the people doing the work. What we really care about is, are we measuring the impact and are we getting change in the people that need to have the knowledge, skills, and attitudes to perform the new tasks? Another question I'll share with you, I'm not going to share all of them, but this was one talking about the leadership. And this was a really big problem. They say, because the leadership, it was clear that the staff did not believe that there was strong leadership guiding their system. And when we don't believe the leadership cares, why do we care? So if my boss doesn't care and his boss doesn't care, I'm really not going to care very much. And this is a really critical intervention. It's one of the most important and scaled up interventions in the education system across the world. If we don't have multiple tiers of support for our students, we cannot move them to and through the education system. So the fact that they didn't have any understanding or belief around that, very little, we have 19% somewhat agree and no strongly agree. Can we agree this is a problem? This was not great data, but we start with the audit and then we move forward. Look at this now. We have 76% strongly agree or somewhat agree. Very few, I don't know about it. And of course, we do have those naysayers in the data system. I tell the people we're working with, we think about in education, we think about the triangle. We want to have 80, 15, 5, 80% of students should be able to get where they need to go with core instruction. 15% are always going to need some support and 5% are need intensive support. And when we're looking at this data, it's kind of right along with that. It's like, oh, we have 80% of the staff there believing this, and we're not there with the rest of the 20%, but we're moving toward that. More data. And this is around something that we're going to touch on quite a bit this morning or this afternoon for you. My school provides professional development, and this is talking about professional training, coaching, technical assistance around skills and strategies to improve instructional practices. At the audit, we had a large percentage of people that were not somewhat agreed or strongly disagreed or did not know. In 2024, we are at 89, 90%. It's a huge, huge change because what matters most is how we help this practitioners to skill up, to scale up. And I wanted to share this data because there's been a lot that's been in place over the 3 years to help to get to these results. Processes matter. This group to get these results utilized co-design, co-learning, co-monitoring. The implementers were actually involved, and I'll show you pictures of the implementers actually doing this monitoring together. We used andragogy, adult learning, and ongoing and embedded high quality professional learning. Because what we know is that it takes up to 20 times of trying a new practice to begin to build initial proficiency. Think about that. Generally, we do a one and done, what I call pigeon PD, fly in, drop a load, and fly out. And we expect the implementers to have the skills and the abilities to be able to perform this. It can take up to 20 times or 50 hours. So that andragogy was utilized consistently in helping the staff develop their knowledge, skills, and attitudes in deploying these new complex strategies that they were resistant to in the beginning. And we called that deliberately developmental implementation. We were deliberately developing the adults in the system to be able to implement. DDI, deliberately developmental implementation, deliberately, repeatedly in a how's it going, what do you need, professional learning, andragogy model. And it included, and I heard this morning in the fishbowl, there was such wonderful conversation this morning. It included stakeholders. Someone was talking about how with the work that they were doing this morning, and she was mentioning including stakeholders. It included the implementers, the people actually doing the work. It included leadership. All systems were aligned. We spent the first 6 months just trying to figure out, will we all play together? Will everyone stop doing some things, de-implement things, and focus on what we really need to focus on? So that took some time to get the stakeholders, the community, the superintendent, the funders to, in a leadership hierarchy, to agree that they're going to actually focus on this so that the staff had the capacity cognitively to actually build their knowledge and skills as we're doing the DDI. Having the systems line was critical. And along with that, the mission and vision, they changed their mission and vision as an organization to meet this need. So now the why was very clear. And they aligned their funding and focus all to scaling this evidence-based practice. They also utilized, as we know, we need theories and frameworks. They utilized the impact implementation framework, and that particular framework includes human and learning centered design. And they utilized implementation teams. They built their knowledge, skills, and attitudes, which I call KSAs. The implementation teams spent a year ahead learning how to be an implementation team, understand implementation science, and understand the innovation that they were going to scale before they deployed it. And that was building their deliberately developmental implementation DDI. They used an implementation plan that was co-designed by the implementation team members that included the stakeholders. They used a PDSA cycle monthly, repeatedly, coming back, iterative improvement. How's it going? What do we need? Using an agenda and data collection, all those kinds of things that were authentic to their context. Then they would co-monitor, do what we called learning walks, review the plan, and provide new learning as a result of that PDSA and reviewing the plan. Sometimes they had to restate their goals on their implementation plan. This is what it really looks like. You can see some data collection that was done by the implementation teams. This is monitoring the red and green. The green and red is like, where are we in each individual person? They did this at a scale, at the organization level, and then they also did it at their site levels. So they co-created the monitoring tools, and then they monitored. So they had these, and then they're actually, you can see people here coming together and learning together and calibrating before they go out and do their monitoring and learning walks. And they performed over 30 learning walks for monitoring what they agreed on were the active ingredients for the innovation. They learned together before they did that so that they could build a critical mass of community knowledge. Because if we go in and monitor, people feel evaluated, and that is not comfortable. So spending time to understand and have these teams communicate when we're going to be walking in and learning, walking through and observing that it isn't an evaluation, right? It was about no shame, no blame. So in this case, individual staff names were never collected. It was just system-wide data that the implementation teams look at to use to iterate and improve in that PDSA cycle. Because again, we wanted to build a critical mass of community knowledge and make sure that the learning that they were providing was based on where people really were. So that's why those calibrated, co-performed monitoring, which we called learning walks, not evaluations, had to happen frequently and involved the implementers. And that's where the funding came in, because people had to be removed from their workplace and they had to pay for another staff member to do their work to be able to perform this. It wasn't just leaders doing it. And I want to end here with, in this section, just to remind people, it does take up to 20 times of trying a new skill to gain initial mastery. And in implementation science, quite often, we miss that piece. We want to deploy and we do an initial training and we don't focus on professional learning. Processes matter. Adding a change theory was really, really important. So they used I'm sure many of you are familiar with the COM-B. So part of that process was using a change theory, using professional learning strategies and protocols. Processes matter. They used the Implement with Impact framework. As I said, there are a lot of frameworks out there. This is the one that they used because it includes human and learning centered design elements on the outer circle. I is including, they included the implementers, meaningful leadership structures, horizontally and vertically, including stakeholders and community. Professional learning, not training. Very, very important difference. Not just training, but andragogy and professional learning. Assess and adjust. And then building, and Vicky's going to talk about collective efficacy this morning. Building collective efficacy, because we know if we have a shared belief and a shared goal, then we can do just about anything. And it's all done with a team. And of course, we're all familiar with the fact that implementation takes place in stages. They used this framework and they also used the impact implementation planning template. So they were constantly built an implementation plan, which of course, it doesn't look like this. Theirs is very, very long and hairy, but then every 3 months they came together as a team and re-looked at that component. They strengthened their commitment to change, inspiring individuals and organizations to commit to continual learning and improvement and implementing effective practices. This is why we're having this conversation today, because we know that we have a need for change and we want to build implementation literacy horizontally and vertically intentionally. And these are pictures of that team doing this work. And I included some photos from when we had our Houston event here in the US with GIS. Another researcher was talking about how they were looking at HPV, and you see pictures here of how when they made the change successfully was when they went to including the implementers. And so you see a picture of the local staff, again, climate context and culture matter. And so they ended up putting this on boats. And you can see here the photo in the middle where that implementation team on the lower right, they would map out their year 3 times a year and look at that through interactive protocols that involved the implementers. So how do we get to those results? We always start with the why. I'm not sure how many of you are familiar with Simon Sinek's Golden Circle, but the model is, we know is that it's grounded in neuroscience, and the research shows that messages that communicate with the limbic system, the part of the brain that's responsible for behavioral and emotional responses, tend to elicit more positive responses. When we tell people why we're doing something, then how we're going to do it and what we're going to do, we have much better results. If we start with the why, we have a better me, better you, better us. And one of the things we want to leave you with is to be relentless about continuously improving the processes by which the work gets done. It's quite another thing to be relentless about continuously improving the people who do the work. We want to focus on the people doing the work, because an implementation support structure, teams, processes, implementation plans is essential for strategic, effective implementation in learning organizations.
So, when I was doing my research on the implementation of reading first in one state, this Guskey's model for change in beliefs and attitudes, which he wrote about in 1987, was really interesting to me. So one of the things that he talked about is that we do professional development, or we provide professional development for whatever group we're with. And in this particular case, it's teachers. We provide the professional development. And if there are changes in teachers' classroom practices as a result of the professional development, that then creates positive changes in student learning outcomes, that results in positive changes in teachers' beliefs and attitudes. So many times teachers may not believe that something is going to work, but if they put it into practice in a way that results in the positive student learning outcomes, then their beliefs and attitudes change, which then creates some sustainability. One little story that I have about this is that long time ago, the school in which I was teaching had Tom Gusky come, and we spent a week with him, like from 10 to 4 for 5 days in a row, around the concept of mastery learning. Interestingly enough, after there were 10 of us in the group, and we asked later, why did you choose us? And they said, because you are risk takers, which we were very excited about being called risk takers. But we got back to our school division after all of this training, and nothing ever happened. Nobody ever even talked about it, mentioned it, asked us what we learned, what can we put into place for this to happen in our district, and so forth and so on. So the next slide. I'm not sure who's changing slides, but so after I did the work with implementing reading first, I started thinking about all the professional development we were doing in the schools that were receiving those grants in our state. And one of the things that was happening is, and one of my thoughts is that between those two middle ovals, that if we align the systems to ensure positive outcomes, which is systems intervention, and we remove any obstacles that undermine positive outcomes, which is the facilitative administration, then changes are going to happen, which are going to change teachers' feelings of efficacy. And then those changes are going to sustain the implementation of it. One little anecdote I have for you on that is that so I was a special ed person in a regional professional development center. And we had reading first facilitators, and I went with them to help implement and do some training. And so one of the schools where we worked, the very first day, we were doing some letters training, and there was only one teacher per grade level because there was only one classroom per grade level, and the reading coach and the Title I director. The building leader, the building principal, and the building superintendent had to come to these meetings, or the state said, we will pull your grant funding. At this first training, those two people were not there. No building principal, no building superintendent. So it was very funny. In a not really funny way, but it was kind of an aha moment for us. So the kindergarten teacher kept falling asleep during the training. The Title I teacher went to the bank at the first break and never came back. But what was interesting about this is that over the year and the next year, I wasn't there very much during the second year, but at the end of the year, I came back and it was like a totally different atmosphere. Teachers were talking to each other. They were excited. They were talking about pedagogy. They were talking about their lessons. And I looked at the reading first person and I was, what happened here? And she said, they started seeing results. And so there were those changes in beliefs and attitudes, and everybody was so excited. And that was my story. And what I really learned from a lot of that was how the removal of those obstacles and the alignment of the systems help to get those positive outcomes and change people's beliefs and attitudes.
I just love that so much.
I did too.
Sorry. So what we're talking about is really this giant leap. Vicki did such a great job describing really what the data that I shared with you in the beginning was talking about. It's interesting how that came to, it was beliefs and attitudes that are now working toward results. And actually, I didn't even share their outcome data. Some of those schools are now the second best out of 690. in the state. It's just crazy. And clearly, as from the beginning data, it was way down. But in all implementation science, what we tend to have is a gap between what we know and what we do. We see that all the time. It's a giant leap because what we know, it doesn't matter how great your idea or your innovation is in principle. What really matters is how it manifests itself in the day-to-day work of the people who need to experience this intervention. Because only 1 in 3 efforts to install a new program is successful, but we have all these grants and all this research being funded, but we're not getting the results. We need things to be implemented. So this is why we're having this conversation today. And Vicki and I just want to really state that we believe there should be a human and learning centered focus in implementation science. Meaning we include people, we have meaningful leadership structures, we have professional learning, andragogy, deliberately developmental implementation, developing the people, iterate, assess and adjust, and collective efficacy, which she's going to talk about in just a moment, and do that with a team.
So as far as enabling conditions to build collective efficacy, again, I think that for me, the facilitative administration and making sure that people are, have everything they need, whether they have the training, the support, the resources, having all of those things around a goal and empowering those people to use what they're learning and being able to share, and everyone having the knowledge and working together helps build that collective efficacy. I think one of the most important things for me in the research I was doing was the supportive leadership piece. And so what I thought about that was that in the state where I was doing the work and where they were doing the work to implement reading first, even though the State Department required that principals and building superintendents had to be in the trainings, they didn't help them understand how to ensure that teachers were feeling successful. And so I did case studies in which I asked people around the state that were facilitators for that grant, tell me about school districts where you feel like it's really working, it's really positive. Tell me about the ones that are doing okay, but maybe not as great as you would hope. And tell me about the ones that were not working well at all. And the thing that I found out was the facilitative administration, whether or not building leaders were actually doing the things that empowered people to have positive results. If in one case, the person who was doing tier 3 intervention was the special education teacher. She was the only special education teacher in the building. She had students that were very, very handicapped in her class. She had an hour to do intervention. And during that hour, one of the teachers of the higher grades was sending kids into her classroom to read tests to them. When she said to the principal, "This isn't working, I can't do this intervention," when other teachers are sending kids in, and the building principal said, "Well, you're just going to have to deal with it." Imagine that feeling of efficacy for that teacher. It was not there at all, and basically she gave up. And the one that I thought was the most exciting, and these are all very small school districts, and the one that I thought was most exciting is that the principal, the building principal, was also the special ed director. And sometimes the superintendent might be the bus driver in some of those, small school districts. So the principal, she talked about how we're going to do this grant the way it's supposed to be done. We can't do less than what is required, but we can do more. And so instead of having the tier 2 be 30 minutes, she had it be 50 minutes. And she pushed teachers into each classroom so that there would be 5 adults in a classroom and they would have 5 small groups. In one of the classrooms, there were not enough people to go in at that time. And she said, I'll take this group of 3 kids. So this was an administrator who was making sure that not only were the kids being successful, but the teachers were being successful. And so that feeling of efficacy in that building was just out the wazoo. One of the teachers said to me, we thought having 5 people in a room at the same time was the stupidest idea we'd ever heard, but it worked beautifully. And they only had in their K through 3 classrooms, they only had 5 kids that needed tier 3 intervention because of what they were doing at tier 1 and tier 2. So their feelings of efficacy were amazing. In other schools, not so much. So it was a very big deal and very exciting.
Great. I love that story because, and this was not intentional, we didn't talk about the stories ahead. It supports that supportive leadership data that I just shared, which is really helping these teams get to that looking at these enabling conditions and implementation science. If we want to advocate that we build collective advocacy components into deliberately developing your implementers and not just sticking straight to one and done practice and training, and that we look at shared goal consensus, empowerment, building cohesive knowledge across horizontally and vertically, including those implementers, and have those embedded reflective practices, and as Vicki said, supportive leadership. Because those conditions help build that collective efficacy, which if we believe we can do it, then we will get it done. We have agreement, and we heard this over the last 3 days at the conference. There is an implementation gap in scaling evidence-based practices. We need to build implementation literacy rather than just be implementation scientists only. We have a science to practice gap. The knowing does not equal doing. Address we're advocating, Vicki and I, that we address human elements of change, which is why we talked about collective efficacy. And she talked about her research with the Vesky's model. And also add in iterative processes to support change, to impact beliefs, attitudes, and skills. We saw outcome data that support the inclusion of implementers. So what our goal is today is to hear from you. We're done talking, but we wanted to, the ultimate aim is to have a World Cafe, and a World Cafe's purpose is to foster collective conversation, ignite a movement, drive real impact in the field of implementation science. And so we look forward to your active participation in this endeavor. And we have a number of questions that will be put forth for your consideration and collaboration in breakout rooms. The format of a World Cafe is that it's a collaborative method for creating a living network of dialogue around questions that matter in service to real work. The World Cafe methodology is widely used across businesses and organizations worldwide. It's a structured conversational process intended to facilitate open and intimate discussions and link ideas within a larger group. The goal is to assess the collective intelligence in the room. I love that, because together we're better, and we need to really harness that information. We want to listen and support rigorous reflection when you're in your breakout sessions and the conversations about putting research into practice. This conversational structure allows us to surface issues from various viewpoints. The goal is to unpack and unearth the things that are getting in the way, as Vicki said, those barriers, and collectively discuss options and actions for improvement, to harness the power of the collective to learn from and with each other. And we want to connect these diverse perspectives, because even if you're not in the same field, Vicki was talking about the field of education, but what's happening in the field of education, implementation science is content agnostic. The same problems, all sectors have some of the same barriers and issues. And so we at GIS believe that we should have cross-sectorial conversations. And so our goal is to foster that cross-sectorial conversation and have collaborative problem solving, rigorous engagement, and harness collective action. So there's usually a World Cafe breakout process, and that means we would go into breakout rooms. And so I will leave this to the next section that we're going to have. This is going to be recorded, and so you'll be able to go into breakout rooms and answer these 3 questions. We'll share these questions with you. Vicki, do you want to read the first question?
So given the issue at hand in your local context, what have you noticed about the implementation, your evidence-based practice / research, and what might be worrying you?
Does anyone here on the call want to have a quick conversation about that question? I see we have Shahar and Hadiza. Okay, the next question that will be addressed when we do this later will be based on your first conversation. What do you think are the barriers to successful implementation? And what is getting in the way? This is a really important question to discuss. If we decide, we figure out what are those barriers, and we can learn from, as I mentioned, cross-sectorial and thinking around things. How do we learn with each other to overcome those barriers and create some facilitators? And the last question that would be addressed is, how might we as a community overcome these barriers that are common across all sectors in scaling an evidence-based practice? Lastly, we want to invite you to include implementers in your design process. Commit to using human and learning centered design. Think about collective efficacy and attitudes and beliefs, and not just the research component. Thank you so much. If anyone has any questions, we're happy to answer questions. If we see any questions in the, I don't see the text chat. Maz, are there any questions?
I am monitoring the chat and do not see any coming in.
Okay. Well, we can say thank you, those of you that were here with us this morning. We appreciate that. And we hope that this was valuable for you and that you go forward and include implementers in the design of your implementation and think about building collective efficacy and attitudes and beliefs.
Thank you so much, Vicki and Janice. I know this was not what we had hoped for, but I think that the with the new members that will be coming in from this conference, we will be able to replicate it with more participants.
Okay.
And it was good practice. It was good practice.
Yeah, it was good.
You can never have too much practice.
No.
And I love,
I've had very little.
it forced me to get that data together because I'm really excited about the data.
And this looked really good, Janice. This is a really great slide deck.
Thank you.
Yeah, good job. I don't know how you do it.
Wonder Woman, both of you, Wonder Women.
Not a lot of sleep this week.
Yeah.
Oh,
yes.
well,
Those
go
are
get some rest.
Yeah,
Vicky, I saw it get progressively lighter as
I know. Oh yeah, look at
throughout the-
that. I'm like,
look.
oh, the sun is rising out there.
Yeah.
It's still dark at your house, right, Janice?
Yes, it is still dark here.
I know. And then I was also thinking, like, I need to figure out a way that you know, the lighting that you have is so great, Janice. Even yours, Mads, and you know, you're there out with, you know, not your own background, but it's a mess in here, you know, and the light from the computers, you know, I'm like, ooh, I look so weird, but oh well. But
No, you look
anyway,
great.
yeah, it's like, whoa.
I like a Zoom filter.
I know, I've got to figure
Yeah,
that
so-
out. Anyway, so thanks, guys. This was good.
Thank you, Vicky.
Thank
You're
you.
such a trooper. We appreciate you. Your voice and input is really valued.
Sounds good,
Really.
guys.
And I'll be in touch about setting up a date for sometime in the next month or so.
Sure.
Sure.
Sounds
Okay.
like fun. All
Thanks,
right, guys.
Great.
Bye.
Safe travels. Enjoy the
Bye.
rest of your stay.
Thank you.
All right, I'm
Thanks.
going back
See
to
you
bed, you
Tuesday
guys.
morning. Yeah, good night.
Bye. Good night.